Okay, here we are with the first chapter of the EMT basic class. I'll prelude this by just saying the first few chapters are fairly dry, but they're fairly straightforward. If you read the chapter, you're going to get the information. The PowerPoint should just reinforce what you read and kind of what you need to know. So the topics that we're going to kind of go through with this chapter, real quick, just the emergency medical services system. We'll talk about how that works for kind of areas around here, and it's pretty much the same throughout the country. Then we'll talk about some of the components of that EMS system. We'll talk about the roles and responsibilities that you'll have as a provider, and then the EMS role within that public health setting. And then we'll briefly talk about just the research and special issues. Those are really not much of the EMS world, but we do play a part in it. So let's start by discussing the emergency medical services system. EMS actually dates back to the times of Napoleon, when French armies started to transport wounded soldiers. It's kind of the earliest documented emergency medical services. Probably the big thing to take from this is it's not what today's EMS service is. In the beginning and really up until the 1900s, basically that service was just provided by putting the patient on some sort of cart, taking them to somebody that could take care of them. Whereas today we provide so much service before you even get to the hospital. It wasn't like that in the beginning. And then they moved on to the Civil War with Clara Barton, who actually helped establish the Red Cross. And then EMS continued to develop throughout basically all of the wars, moving forward into the early to mid 1900s. When you got into the Korea-Vietnam era, you really started to see more of that pre-hospital care being provided in the field. You started seeing some of the aeromedical transport with helicopters taking patients from the war zone into the actual medical components where the doctors were, and it just kind of kept evolving from there. And when you look at the non-military ambulance services, it began in the early 1900s, kind of reached out to the smaller communities by the 1940s. Early on, it was really taken on by the fire service and more so by the local funeral homes. Up until really the 1970s, around our area, the funeral home was actually the one in charge of the EMS and getting the patient to the hospital. Now, there was really no service provided to the patient. It was literally just a taxi service. They threw him in the back of the hearse and then transported him to the hospital where they could get that definitive care. And that's probably where EMS has gotten the kind of the know-how of being ambulance drivers when it's not like that these days. So in 1966, the government actually tasked the Department of Transportation with developing the EMS standards. It may seem a little odd that the Department of Transportation took that under, but that's the department that actually did have it. It's actually a fairly common test question too, so put that in the back of your memory bank. And then shortly after that is when the NREMT, the National Registry of EMTs, was formed, which is still kind of the gold standard to EMS today. It's how most of our guidelines are built from an education standpoint. It's also where you'll get your licensure from, which we'll talk about later. And then in 1973, the National Emergency Medical Service Systems Act was passed by Congress, and that really started to set all of the rules and regulations in place for how EMS functions today. So the National Highway Traffic Safety Administration Technical Assistance Program is who established an assessment program with a set of standards. There's 10 standards that we'll talk about, the first being the regulation and policy. So each state establishes laws, a lead agency. So in the state of Illinois, our lead agency is actually the Illinois Department of Public Health. They kind of fund the mechanism, policies, procedures, and regulations. They're who we report to. They're who controls our license within the state of Illinois. Even though you'll get your license through the National Registry, you still have to get licensed in the individual state that you'll function. So if you were to work in the Quad Cities area, you're going to need to have an Illinois license as well as an Iowa license, and each state's going to have different standards. Although they're very similar, there could be some differences, but you need to be licensed in each state to be able to function in each state. If you're licensed in Illinois as a paramedic, that doesn't mean that you can function in Iowa as a paramedic. There's some steps that you have to go through. They're also going to be talking about the resource management, which is the centralized coordination of emergency treatment and transport resources. In Illinois, we have several different agencies to kind of help take care of large disasters throughout the state. This resource management system is what helps us do that. Then we'll move down to kind of more of the local level with a human resource and training program. And basically each service is tasked with creating their own internal operation that develops the training so that we can maintain a certain standard of treatment for our patients. And then at the local level, we're also going to talk about transportation, which we provide safe, reliable transportation. Transportation has kind of become one of those topics in the last few years that you just have to be a little bit more cautious with. When you run emergent, when not to run emergent, when you load your patient and go right away, when you kind of stay on scene and take care of your patient, if you're a lower level provider, when you need to call for advanced level to take care of the patient versus when you can do everything you need to do to get them to the hospital. Next couple topics of importance here are facilities and communications. So facilities are going to be talking about transporting to the closest appropriate facility. When you think about closest appropriate facility, the closest facility may not be the most appropriate facility. With everything that hospitals do today between trauma systems, cardiac centers, burn centers, anything that you can possibly imagine, sometimes you're better suited to actually keep your patient in the ambulance longer, get them to the appropriate facility versus just taking them to the closest facility where all they're going to do is kind of give them a once-over, stabilize them, and they're going to ship them right back out. So the definitive care has kind of been held up because you didn't go to the most appropriate facility. And we'll talk about this more as we go through some of the assessment process and further into the book. And then when we talk about communications, everybody knows there's the universal system access number, which is 911. If you're in an emergency, you're going to call 911. What you don't think about is the other types of communication. So the dispatch has to be able to talk to the ambulance. Most of the time that's done through radio systems, but we also have phone capability in case the radios are down. And then you have ambulance to ambulance. If you're on a scene where you might have multiple ambulances coming in, it's important to be able to communicate to other ambulance services. For example, we run on the VHF system, which we'll talk about later, but some of the agencies in the Quad Cities run on an 800 megahertz system. So those two systems are not compatible. They don't communicate with each other. So you have to have systems put in place so that you can assure communication from ambulance to ambulance. And then from ambulance to hospital, you absolutely must give a radio report of some sort to the hospital so they know what you're bringing in. If you're bringing in a cardiac patient that might be having a heart attack, they're going to call what's called an MI alert, which is going to activate some of their internal teams so that they can get that patient to a more definitive care faster. And then the last thing is the hospital-hospital communications, which we really don't see on the EMS side, but with what we talked about earlier with the closest appropriate facility, it's very common that hospitals transfer patients out to other facilities. When they do that, there's a system within the hospital that they have to communicate from hospital to hospital. Next is public information and education as well as medical direction. Public information and education is not something that we do a great deal of, especially in the smaller communities. We probably should be more active in the community. There are certain things that we have done in the past here locally. There's programs out like Hands-Only CPR. There's other programs around like Safe Kids was in the Quad Cities. They were the ones that did the car seat safety checks. So you could set up, public information sessions within your local station, have people drive in with their car, you check their car seat, make sure it's installed right, just do some public education with them. From an EMS standpoint, really your bigger role in the education is when you're on scene with the patient and you can physically see things that could maybe be a hazard to that patient. You need to be able to tactfully communicate to them, hey, perhaps if you did this, then you could fix this problem. So, for instance, we had a patient that used to call all the time because when she put her automatic chair in the upright position, it was on a hardwood floor, she would slip out the bottom of the chair. It was a fall hazard. We were called there multiple times just to help her up, but we were also called there because she had fallen and hurt herself. So what we did is worked with her family, just with a very simple process of, hey, let's get something underneath the chair so when it goes into the upright position, she doesn't just slip out the bottom of the chair. And so that's really more from an EMS standpoint, your role in that public education that you'll see on a day-to-day basis. The medical direction we'll talk about further. Basically understand that as an EMS provider, you have a medical director to report to. They're your resource in case you have questions. And the last couple standards to touch on here are trauma systems and evaluation. Trauma systems are going to develop the trauma triage, transport, and treatment protocols. There are different types of trauma centers that you'll be working with. Here locally, the highest level of trauma center we have is a level 2 trauma. If you get down to Peoria, out to Iowa City, you'll see level 1 traumas. And all of those systems work together to kind of build resources at the local level to help you provide adequate care for your patient. And then the last thing, which I think they talk about later in the chapter as well, is the evaluation, which we're going to develop some quality improvement, quality analysis training, just to be able to evaluate what you do, what you can do better. EMS is one of those fields that you always want to be improving in. You always want to be providing the highest quality of care. To do that, you have to be consistently evaluating what you do and what you can improve on. So let's talk about the components of the EMS system. Basically, anytime a patient is in need of emergency medical care, it's going to start with a call to that 911 system that we talked about. That call is going to come into the emergency medical dispatchers. They're the ones that are going to activate the EMS response in us, so they will tone us out with whatever methods that they have. Then the EMS responders will respond to the scene. They will take care of the patient. They will transport the patient to the emergency department, where you'll find the doctors, nurses, and everybody else that's going to provide kind of that final care to hopefully get the patient into a better state. And like we talked about a little bit earlier, with the specialized care facilities, when you're looking at that closest, most appropriate facility, you have to take into consideration what facilities that you have that you can transport them to. So do you have a trauma center with a designation? Do you have a burn center? Pediatric centers? Really, a lot of hospitals have become cardiac centers. That's where you're going to provide a cath lab to provide them that definitive care when they're having a heart attack. And then stroke centers is going to be your best bet. That's going to have neurological capabilities. It's kind of a difficult field to get coverage in these days. So you want to perhaps take that patient that's having a stroke to a facility that's going to have a neurologist there or a neurologist on call that's going to be able to come in and give them the best care possible. So let's take a moment here just to think about a couple of these questions. So obviously this class encompasses a wide range of communities. We have some college students up in Wisconsin. We have some from Iowa. We have some from Illinois through different communities around Erie. So what medical services are available in your community? Erie has an intermediate level service, which we'll talk about a little bit later, but we provide kind of advanced care to the patient, and we are probably 30 minutes from any hospital. So what do you have in your community? What capabilities are there? How close is the closest ambulance to you? How close is the closest hospital to you? Kind of some of those things we talked about, just kind of put into perspective with where you're at currently. Next, how important is it that EMS personnel know the capabilities of community medical facilities? So it is very important for you to understand what each facility is capable of so that you can get that patient to the best possible place to get them the best possible care in the most timely manner. And then the last question they talk about here, what are the possible consequences of transporting a patient to a facility not equipped to handle the problem? So for example, with a heart attack, time is muscle. So if we take a patient 20 minutes to a hospital that doesn't have cath lab, time is muscle. The longer that they're having that heart attack, the more damage is being done to their heart. So now you've taken them 15, 20 minutes to a local hospital. They're going to stabilize them. They're going to verify, yeah, they're having a heart attack. They're going to need to get them loaded up, and then they're going to need to transport them to a facility that does have cath lab procedures. So now you're talking hour and a half for that patient to get into the cath lab, versus if you would have just driven the extra 15 minutes, maybe it's 30 minutes to a hospital with a cath lab. They're in the cath lab in under an hour, and it could make a big difference in the outcome of what that patient sees. This is for those of you that are visual learners. So when you think about accessing the EMS system, just kind of follow the diagram here. So you have a patient, they call 911, comes into the emergency medical dispatcher. The emergency medical dispatcher gets responders to start responding to the scene. EMTs arrive on the scene, load the patient up, transport the patient to the emergency department. Emergency department takes care of them, gets them to the allied health staff, which is kind of where is going to be their landing point within the hospital. If you go to a hospital that has many different capabilities, they might have a cardiac floor, they might have an intensive care, they might have a pediatric floor. So that's going to start in the ER. They're going to get the patient kind of stabilized, taken care of. Once all that's done, then they'll move them on to whatever the appropriate floor in that hospital is, to hopefully get them better to the point that they'll get out of the hospital. When it comes to actually accessing the EMS system, we've talked about it a couple times. It starts with that 911 telephone call to the dispatchers. 911 is widely available in almost all communities. You can call it from your cell phone. You can call it from a landline. Enhanced 911 actually helps the dispatchers when possible, because it's going to provide that callback number for them, and it's actually going to provide a location. It's more easily done with landline. The technology is starting to catch up to where they can triangulate positions with cell phones to kind of figure out where you're at as well. Just know and understand your cell phone, so that if they don't have that ability to kind of track where you're at, you're going to be able to tell them where you're at when you're calling 911. In fact, today there are even many areas that are using texting to 911. So it continues to evolve. It's going to continue to become a better and better system throughout time. So let's talk a little bit just about emergency medical dispatchers. They're kind of the unsung heroes of the EMS system, because there's a voice and there's never a face to that voice. But it's a very stressful job. It's very difficult and task-oriented because you have so much going on at one time. You're talking to the patient, you're giving them instructions while you're also dispatching out the medical crew. You're collecting all the information to give that medical crew. It is a very stressful job, but the emergency medical dispatchers, they can give instructions to the caller on how to provide emergency care. Probably the most important thing that they can do is provide instructions on how to give CPR, because early CPR is probably the most effective way of sustaining life and actually having a good outcome in a cardiac arrest. So really, those emergency medical dispatchers are complete unsung heroes in what they do. It is a very challenging job. If you ever get a chance to go in and sit and just watch what they do and how they do it, you'd probably be very impressed. And to put a visual to all of that, just look at the workspace for this dispatcher. There's 4 computer screens, a keyboard, a mouse pad. She's got the ability to talk to the caller in her ear. That can transition over to talk to the crews that she's dispatching. If you can't tell just by looking at this picture, it is a very challenging job, and it's a very stressful job because they're going to see these patients and hear these patients at the worst possible time, and then when EMS gets there, it's done. Like, they're cut off. They kind of have to wonder what the outcome was. Sometimes, depending on how closely they work with the agencies, they'll hear some more. But like I said, it's a very stressful job. Working in EMS is going to definitely test your critical decision making, whereas most calls are fairly routine, fairly straightforward, not challenging at all. The stressful calls are stressful. It's going to test your critical decision making, your ability to gather information at the scene. Really, probably the most challenging thing is to provide that proper patient assessment, because your treatment is based on your assessment of the patient. So if you listen to lung sounds and you kind of diagnose them improperly, you may take the treatment down the wrong path. So your decision making, your ability to properly assess patients is very important for the outcome of that patient. You need to be able to take that information, interpret it, determine that course of action that you're going to have for the patient, determine what you're going to do to make that patient better while you have them in your care, and determine where to take them to get the ultimate best care possible. When there's not enough information, ask questions. It's important to ask questions early, because if you have a critical patient, they may be unconscious 5 minutes from now, and if you don't take the opportunity you have to get and gather as much information as possible, then you might be flying blind for a portion of the call. So looking at and this is just a very brief couple examples of critical decisions, and the one we've hit home a couple times, but it's that transport destination. Do you take your patient 15 minutes to a hospital that has minimal resources? Do you take your patient 30 minutes to a hospital that's maybe trauma designated or has a cath lab for the patient that's having a heart attack? You have to make that determination in the field. You do have resources to help you with that, but ultimately that determination is going to be yours. Another example, as a basic, you will carry some medications. You have to understand those medications. We'll go over them, what you carry in depth later on in the book. But could it help the patient? Could it make the patient worse? If you give this medication and for whatever reason the patient gets worse, what are your next steps? So it's a very systematic approach to how to take care of the patient. So let's talk a little bit about the different levels of EMS training. So there are 4 fairly general EMS training certifications that you can get, and they're labeled differently from state to state, but they're all pretty much the same thing. You guys are going to be enrolled in the emergency medical technician class. We also call it the EMT basic class, but that is what you are enrolled in. Kind of one step behind that is the emergency medical responder, formerly known as a first responder, and that is a very basic, basically able to recognize some of the medical emergencies and treat the life-threatening ones, and that's it. It's like a 40 or 48-hour program. It is very, very basic. The emergency medical technician class that you guys are in, it'll give you guys some more information. You're going to have an understanding of most of the medical emergencies, and then some of the basic treatments that you'll be able to provide for them. Kind of one step above where you guys are at now is the advanced emergency medical technician. In the state of Illinois, it's kind of called the emergency medical technician intermediate, but they're going to be able to provide more treatment, perform more skills on the patient, so they'll be able to do things like start IVs, start interosseous, give a few more medications, just do a few more things to provide a higher level of care, and then ultimately the most advanced level of emergency medical technician training is going to be the paramedic, and that's really going to encompass everything that can be done in the pre-hospital setting. Most states allow you to go straight from basic to paramedic. You'll be able to skip that advanced EMT if you choose to move on beyond the basic level. And then with the paramedic, there's also some crossovers as well. So nurses can get certified as a pre-hospital registered nurse, which basically gives them the equivalent certification to a paramedic. Let's start talking a little bit about some of the roles and responsibilities that you will have working in an ambulance as an EMT. So the first thing probably the most important role is personal safety. You can't take care of anybody if you're not safe. So if you go to a suicidal patient, the first thing you're going to want to do is make sure the scene is secure. Make sure that the police department are on scene. If you walk into that scene without the police department and somehow that patient hurts you, you're not going to be any good to anybody. So the number one thing through all of EMS is your own personal safety. You have to be number one. Shortly behind that is going to be making sure that there's safety of your crew, the patient, and the bystanders. You play an important role in just the overall safety of any scene that you're at. Next thing up here, working with the other public safety professionals. As an EMS provider, it's not just you going to most of these calls. You're going to work closely with the police department. You're going to work closely with the fire department. You're going to work closely with doctors' offices. There's a number of entities within the public setting that you're going to need to be able to work with, be professional with, and get along for what's in the best interest of the patient. And then moving on to the actual patient side of things, you're going to need to be able to provide proper patient assessment. We've already talked a little bit about the care that you provide the patient is based on your assessment. So we're going to give you the tools to properly assess the patient. Lifting and moving the patient. There are really a couple things that are kind of the top EMS killers as far as longevity goes. One is burnout, very common, and it's one that's a little bit more difficult to control because sometimes it just takes that one bad call to make things bad. The second thing, though, is injuries from not properly lifting and moving patients especially. Back injuries are all over the world of EMS, so we'll go through an entire chapter on just lifting and moving patients, how to properly do it, how to make sure you have the resources there to properly move that patient. And then you move into that transport phase, which is getting that patient from the scene to the hospital. Again, we've talked a little bit about it, but when to run emergent versus when to run non-emergent. In today's society, it seems like everybody sues everybody. So, put yourself in the shoes of you have this patient that's not all that ill, not a true medical emergency, but you're taking them to the hospital. If you're running with lights and sirens and getting in an accident, guess who's going to be held at fault? It's going to be you. So there's some decision making when it comes to the transport of the patient as well. And then once you get to that hospital, you see that transfer of care where you're going to hand that patient over from what you've done to the hospital staff so that they can continue the care. And then with that is the patient advocacy, which is where you're going to pass on all of that information. You're going to be an advocate for the patient, kind of telling them what the patient's been through, what you've done for them, kind of some of your findings. Sometimes you may have to step away from the patient, talk to the nurses so that you can advocate for the patient even when the patient doesn't want to advocate for themselves. So some of those mental health issues and just areas along that line where you need to just talk to the nurse separately and say, hey, this is what's going on. This is what family told us. This is what we've seen at the actual residence where we picked the patient up. These all play an important role. So kind of from the start until the end, these are your roles and responsibilities of being that EMT. Time to kind of think about it again. So a few things here. How would it impact an older adult patient if you're taking them to the hospital? They can't see and you don't take the 2 seconds to grab their glasses or their hearing aids or their dentures. I understand that when you have a medical emergency and it's a life or death situation, don't worry about any of that stuff. You need to get the patient to the hospital. The vast majority of people that we transport to the hospital, though, you will have those few seconds to grab what the patient needs within reason so that they could be more comfortable at the hospital, so that they can communicate appropriately, so that they can have a better understanding of what's going on. Kind of the next thing to think about, on a routine call, would it take time to gather these items, have a negative effect? So like we just talked about, this is where you have to use some of that critical decision making that we talked about earlier. Is this a load and go patient? Is this something to where I have a few minutes, I can gather things, I can gather the patient's medications so that the hospital can physically see them. They like to have the medication bottles there. And then the last thing is, when you're leaving the patient's residence, is the home secured? Is it locked before you leave? Have you communicated this with the patient? Hey, what do you want me to do? Do you want me to lock your house? Do you want me to leave it open? These are all little things that you don't think about in the world of VMS, but when you're taking care of a patient, it's important to them. So just take the time, put it into consideration, and then kind of act from there. And the next thing it talks about is this patient advocacy and how it can extend to the community. So, there are probably countless things that you could come up with, but it talks about the fall prevention programs, the poisoning awareness, things like that. Probably one that we've discussed. We haven't been the most active here locally, but hopefully in the near future we'll become more active, is with the hands-only CPR program, because that is giving the patient the best chance for survival in a cardiac arrest situation. And it's truly like a 10-minute program where you bring people in, give them the ability to do actual hands-only CPR on a patient, kind of go through the technique of how it's performed. That would be a patient advocacy program that, I would personally like to see. Like I said, there are a number of programs that you can put out there. Next few slides are going to talk really more about your physical traits of being a good EMT, and it is important to kind of look at these with an open mind. So the first one, from a physical standpoint, you need to be able to lift and carry equipment and patients up to 125 pounds. Yeah, you're going to have 200, 300, 400-pound patients, but you're also going to have resources where you can get assistance in lifting those patients. But you need to be able to do your part. Some of our bags weigh 50, 60 pounds. The cot itself weighs about 80 pounds. So from a physical standpoint, there are kind of certain things that you need to meet as far as requirements go. You need to have good vision, or have corrected good vision, so that you can do things like look at your medications and see what the drug out date on it is, so that you know if your drug is good or not. So that you can properly assess your patient. You need to have an awareness of any problems with your color vision. You may not think it's important if you're colorblind or have color vision issues, but if your patient is becoming cyanotic, their lips are going to start to turn blue. If you can't recognize that by visually looking at them, it becomes a problem in the assessment category. It may seem kind of gross, but if your patient is vomiting, is the vomit bright red? Is it black? Is it green with bile? It's kind of important for you to be able to look at that and assess it, because that does help with the path of kind of what's going on with the patient. Next thing here is good communication skills. We've talked about it a little bit, but you're going to have to communicate with tons and tons of people in the world of EMS. Most importantly being your patient, but with other agencies that you work with the dispatchers, with the hospitals, with the family. You've got to be able to communicate well with them. You've got to be able to communicate in the written format very well as well, just because we'll talk about it. It's got its own chapter, but when it comes to documentation, it's what keeps you out of court. It's what kind of proves your point if you do end up in court. You've got to be able to write good charts. So you've got to have the ability to have those good communication skills. Moving on to some more of your good EMT traits here. Being pleasant, being sincere, being cooperative, being resourceful. If you're a grouch or a complainer or somebody that doesn't want to make the patient feel like they're the most important thing to you at the time that they're with you, it's not what's in the best interest of the patient. You need to be pleasant. You need to be sort of social when you're around them. The vast majority of patients don't need any definitive care in an ambulance. The vast majority of the patients need a ride to the hospital, and they need somebody that's going to be compassionate, somebody that's going to be open with them. And truly, the vast majority of your patients that you take to the hospital, you can have them feeling better by the time you get to the hospital just by being pleasant and by being sincere with them. Don't pass judgment on them. You're going to see a lot of patients where you think, oh my God, why did this person call the ambulance? Just because it's not a medical emergency to you doesn't mean it's not a medical emergency to them. So understand that if they've called the ambulance, they obviously felt the need that, hey, this is important enough for me. I feel bad enough. I need the ambulance here. That's what your job is. You need to be cooperative and resourceful in the aspect of you're going to work with many different agencies. You're going to work with many different people. If you can't work cooperatively with them, it's going to make for a bad scene. It's going to make for a chaotic scene. It's going to make for perhaps a delay in that patient getting to that definitive care that they need because you're not able to get past your ego or whatever the case may be. Just understand that you have to work with other people. Your idea may be not always the best idea. So be open-minded when you're working with them. Be resourceful. Understand what other resources there are out there. Understand that, hey, if I have a question, I can call my medical control and they can help me with the answer. Just understand all of those resources that you might have. So looking at the visual image, a professional appearance inspires confidence. And it's valid to a certain degree. Some people have confidence, some people don't. If you're good at what you do, you should be confident. If you're out taking care of the patients, they want to see somebody coming in that looks like a professional because it's going to instill confidence in them as well. It's going to make them feel like, hey, this person knows what they're doing. And it's bad because I just got done telling you not to pass judgment on your patient. But on the flip side, you don't want your patient to pass judgment onto you. So if you come in looking like a train wreck, they're not going to trust you. They're going to have a hard time having you take care of them. So really, professional appearance is very important when taking care of a patient. Some more personal traits here. Being a self-starter. You might be put into the situation where it's your decision on life or death for this patient. So you need to be self-motivated. You need to really take a grasp on the education that you're about to enter and understand that, this isn't your routine college class to where if you get a C, it's not a big deal. When you get done with this training program, the expectation is you can be thrown into a situation and have to save somebody's life. So be a self-starter. Understand that it starts with learning the material that's presented in front of you right now. You need to be emotionally stable. And the other thing you need to understand is you're going to be put into some very, very awkward and bad circumstances. If you break down and start crying, it's not going to be good for the patient. It's not going to be good for the outcome. If you get frustrated and frazzled, it's not going to be good for the patient. It's not going to be good for the outcome. You have to have confidence. You have to be emotionally stable. You have to be able to kind of move forward, whether it's a routine call or a life or death call, and understand that it's basically going to be you're the same person no matter what. You have to be able to lead. We've talked about it a handful of times, the importance of working with other agencies, with other partners. You're going to be entering this as a new EMT, but 10 years from now, you might be the senior EMT, and other people are going to look up to you. You need to be able to lead them in the call because that's going to be what's going to be in the best interest of your patient. Being neat and clean and organized is very important. It instills confidence in that patient when they look at you to understand, hey, this person can take care of themselves, so you know what? They can probably take care of me. You need to be of good moral character, respectful to others. You're going to see different cultures. You're going to be put in different situations with different ethnicities. And you need to understand that just because you have an opinion doesn't mean everybody shares that opinion. We're going through a time right now with COVID where The big question is the vaccine mandate. For me personally, I got vaccinated. I believe in the vaccine. But just because you or somebody else doesn't believe in it doesn't mean that I should look down upon you or think less of you when I'm taking care of you. My job as the EMT, as the paramedic provider, is to give you the best quality of care possible and get you from point A to point B so that you can get taken care of and hopefully get better. Last few traits they'll talk about here is one is your personal habits. Whether you smoke, whether you drink, no matter what your personal habit is, you need to be in control of it. You need to understand that under no circumstances is it appropriate that you have any sort of alcohol in your system when you're taking care of a patient. I know the textbook says, 8 hours prior. For some people, 8 hours prior isn't even enough. So you need to understand that, hey, tomorrow I'm on call. These are my limitations for tonight. That's your job as a provider. You need to be able to control the conversation and able to communicate properly, whether it's with the patient, whether it's with the people you're working with, or perhaps it's with the family. Perhaps you have a bad outcome or what you expect to be a bad outcome with the patient. You don't want to give false hope to a family by telling them, hey, everything's going to be fine. We're going to get them to the hospital. You need to be able to control that conversation. You need to be able to communicate it properly to the family that this is what's going on. It's a very serious matter. We're going to do everything within our grasp to be able to get them to the hospital. However, understand there could be a bad outcome. Be open and honest in your communication to the patient, to the family, to everybody that you're working with. You need to be able to listen to others. Understand that, your idea is not always the best. Your mindset's not always the best. Your theories on things aren't always the best. Be open, be willing to listen to other people, whether it's your patient or the people you're working with. And then the last, kind of most importantly, be non-judgmental, be fair. Understand that your job is to take care of the patient. It doesn't matter if they're green, black, red, yellow, blue. Your treatment for them should be the same no matter what the circumstance. You're going to be given the guidelines, you're going to be given the protocols to follow. So no matter the situation, provide them with the proper care. Okay, a couple slides to talk about education here. EMS has changed immensely over the last 10, 20, 30, 40 years. Honestly, it changed a lot from year to year. Your job to be able to provide quality care in the future is to understand that your education doesn't stop at the end of this program. If you're going to be an EMT basic for the rest of your life, understand that the education is going to continue through the entire career that you have. There are things out there like refresher courses. A couple facilities around here offer like an EMT basic refresher course, which is 24 hours, I think, every year that they do. Just kind of go over all of the general topics, keep you up to date on some of the changes, things like that. Then there are continuing education courses in which they can be done online, they can be done in person. There's a number of different ways to get continuing education. For us, our department offers continuing education every month. It's usually an hour or two worth of training. And a lot of the time it's refreshers on things that you think you already know. But trust me when I say that you might be thrown into a situation once with something that you've practiced 100 times. And when you get put into that situation, it may not be as easy as you think. So, for example, we've had tourniquets on our ambulance for a few years now. I've seen it. I've used it. I've practiced it dozens of times. Thought it would be something that I never really used in the real life, because in 20 years I've maybe only had a couple circumstances where I would actually say that I've used it. Fast forward now to a call that we had recently involving a young high school age kid that was in a car accident, had pretty much ripped his leg off. I pulled that tourniquet out, spent about 2 seconds looking at it thinking, do I remember how to use this? And then everything kicked in and it was fine. I was able to get it on in the appropriate amount of time. I was able to get it set, and it did its job. It got the patient to the hospital. But if I hadn't practiced that the number of times through our continuing education, I don't know if I'd have been in that same situation. So never take your continuing education for granted, even if it's something that you think is monotonous and I'm never going to do this, or I've done this 100 times. Why do I need to practice it? It's always important to do it. And then you can always also go to conferences, seminars, lectures. There's things all over the place. In fact, I know my wife Marcy is a nurse practitioner. She's actually going to do a continuing education on a cruise, I think, next year. So there's a wide variety of ways to get the education moving forward that you need to stay up to date on things. And just a little visual here, kind of reinforcing that EMS agencies, we adopt new procedures, new equipment, honestly more often than you would think. The research provided evidence, and it shows that this equipment and medications are effective. So usually 2 or 3 times a year we have something pop up. The latest one for us are IT clamps, which again is something that I don't think I'll ever use. But when I need to, it's important to understand how to use it, how to apply it, and what its job is. And it's something we'll show you down the road, but just understand the importance of the education. So a couple more things to think about here. First one is, given the last few slides, what do you think you'll do to refresh your knowledge and stay current once you're out of the classroom? Understand our agency offers training once a month. The previous agency I worked at, they didn't offer training. You were on your own to get your continuing education. So just kind of look around. You could probably Google it and just see kind of what different opportunities there are out there for you. You'd probably be pretty interested to see, really how far some of that goes. Next thing kind of hammers home those qualities in the EMT. And rather than looking at the qualities from what you provide to the patient, look at it from, if I'm the patient, what qualities do I want to see in an EMT? Do I want to see them, come in unkept, haven't showered in 2 days, maybe smells like booze, the importance of that professional appearance. How can you come closer to this, to being this kind of EMT? Just think 6 months from now, after I have my EMT license, what will I do to assure when I go on that call with that patient that they're going to look at me and believe that I can actually take care of them and believe that I can actually make them better. Now let's look at, where will you become a provider? I believe the vast majority of you are taking this class because you understand that you want to be on an ambulance service. But also understand that becoming an EMT provider, whether it's a basic or a paramedic, you're not landlocked to just being in the back of an ambulance for your career. There are ample opportunities for you. Probably the biggest, most common one are the people that want to go into the fire service. Many of the fire services around these days are requiring you to be at least EMT certified, if not paramedic certified. So this class is a big step towards that. But even beyond that, there are different teams that you can get on. There are different organizations throughout the state that you can get on. There are industrial settings, places like John Deere, places like Alcoa. They hire EMTs in there to work as well. The hospitals hire EMTs to work in the emergency department as techs. There's all kinds of opportunities. So don't feel like you're just landlocked to, hey, I'm going to get this and I'm going to be in the back of that 4x6 box for the rest of my life, whether you're volunteering, whether you're looking at going to a paid service. There are plenty of opportunities out there for you. Okay, earlier we talked a little bit about the NREMT. That's the National Registry of Emergency Medical Technicians. They are basically, like I said earlier, the gold standard to what an EMT is and what it's required to be an EMT. The vast majority of states have gone to the NREMT exam. Illinois just transitioned over the last couple years to basically you have to take the NREMT to get an Illinois license. Before they had their own state licensure exam, and they've kind of gone away from that a little bit. So understand that when you're done with this class, we'll go through a whole process on what you need to do. But basically, you're going to register through the NREMT. You're going to have to go take a written exam on a computer. And then when you pass that, you're going to be licensed as a National Registry EMT. Doesn't mean you're actually licensed in any individual state, but it's kind of like the golden ticket to say, hey, I've met all the requirements to be an EMT, so now can you give me your state license? So in the state of Illinois, you pass the NREMT exam, you get your NREMT license in the mail, you get a copy of your CPR card, and then you fill out a piece of paper that says you don't have child support, that you've never had a felony, and that all gets filed to the state, and then the state of Illinois says, okay, here's your Illinois license, you can now practice in the state of Illinois. It's a very similar process through all the other states as well. Like I said, it'll help with the reciprocity from moving to state. It's also going to be beneficial when applying for employment, because if you work for a service that maybe is multi-state, so like Genesis in the Quad Cities covers areas in Illinois, they also cover areas in Iowa. If they have one single position open and they have a choice between hiring somebody with a state of Illinois license or an NRT license in which they're able to practice in Illinois and Iowa because they've got a license in both states, they're probably going to hire the dual state person because they offer them more flexibility with staffing. So let's move on to quality improvement, quality assurance topics here. Basically, it's the continuous self-review with the purpose of identifying aspects of the system that require improvement. And then when you find those areas that require improvement, you develop a plan to correct deficiencies and improve performance. So I can tell you from our service, one of the things that we do is we log every call we have into a spreadsheet, and it tracks things like how long did it take us to go en route, how long did it take us to get on scene, how long were we on scene. So we can take that data, measure it, and say, hey, how come our scene times are up by 20% this month? And then we can go back to the crews and work with them, figure out, were there certain hurdles in their way that prolong scene time? Was it out of their control? Are there tools that we can give them to help lower that scene time? So it's just one example of how we do things internally. There are a number of things that you're going to be able to do, a number of things that management is going to measure and look at, and just understand that the goal in EMS is to always be getting better. What you're doing today, can it be improved upon tomorrow to, provide a better outcome for your patients? And you need to understand that everyone in the organization has a role. It doesn't matter if it's a management that never sees the back of the ambulance, if it's the driver that's only CPR certified. Everybody plays an important role in this improvement process. So you need to be able to prepare that written documentation carefully in case it does go to court. You need to obtain feedback from the patients and hospital staff. Not done widely, at least here at the local level, but we do talk to hospital staff from time to time and say, hey, how have things been? We brought this patient in. Was there anything we could have done better? Kind of just look for some of their input. Maintain your equipment. If you get into the back of the ambulance and your cardiac monitor is dead and you need to shock the patient, who's that going to fall back on? That's going to fall back on you. So part of your quality improvement is developing a plan to make sure all of your equipment is in functioning order. And then you need to continue your education. Like we talked about with the education segment, things change all the time. Guidelines are always changing. You need to be always moving forward with your knowledge base to provide the best, most adequate care. Let's talk a little bit about medical direction here. We talked earlier about the Illinois Department of Public Health as the ultimate authority in the state of Illinois. Under them, you're going to have EMS systems, which are scattered throughout the state. Some areas, like the Quad Cities, even have multiple EMS systems that agencies work under. We'll report to that EMS system. Ultimately, the person in charge of that EMS system is going to be the medical director. They are responsible for the patient care that we provide, for the training that we utilize. Basically, we have to put together our annual training list every year, give it to them, which they approve. And then this medical director also develops the treatment protocols, which is basically going to be our standing medical orders, which says you can do all of this stuff without calling medical control. We get trained on what those protocols are, and that's what we work under. Then they're going to also give us online medical direction, which may not necessarily be the actual medical director, but it's going to be the medical direction, which is going to be a physician that understands our protocols. It's going to be our go-to person if you get into a situation that you're not sure what's going on, that you need answers to, or there are specific situations which you have to have medical direction authority to do things. So, for example, for us to take somebody and put them in physical restraints, we have to have actual medical direction. We have to call, give a quick report. Hey, this is what's going on. We would like to, put this patient in restraints for their safety, for whatever the reasoning may be. They give us the authority to do so. We put the restraints on. We're operating underneath of them. So ultimately, that medical director is the person that we look to for guidance in everything that we do as far as a care standpoint goes. Moving on to the EMS role in public health, there are a number of things to look at here. Different agencies do different things, from injury prevention in geriatric patients to injury preventions for youth, whether that's bicycle helmet safety stuff at the school, whether that's car seat safety checks. EMS agencies are actually starting to get a little bit involved in the public vaccination programs, as well as disease surveillance programs. Beyond that, kind of the newest topic that's come out here recently that I expect to keep progressing moving forward is community paramedicine, where you may work with a doctor remotely, and basically you go to the house, you provide the assessment, you give all that information to the doctor, and the doctor may give some sort of online guidance to them. The goal of this is to keep patients out of the hospital, get them better before they get to the point of having to go to the hospital. So that's one of the things that's kind of moving forward in the EMS role of public health as well. Next item here is research. Research impacts EMS through a focus on improved patient outcomes and through evidence-based techniques. Probably the easiest way to explain this is CPR. With the American Heart Association, they're always doing research in how to improve things. So, for example, even as early as maybe 6, 7, 8 years ago, kind of the first steps to CPR was always ABCs, airway, breathing, circulation. They've done research, and then through some evidence-based practices, they decided that, hey, no longer is it ABC, it's going to be CAB. They've discovered that circulation is actually the most important aspect of that acronym, knowing that, hey, the oxygen actually maintains in the bloodstream longer than what they thought 20, 30, 40 years ago. So really the most important thing is pumping that blood through the system while it has oxygen in it. And that's where they kind of determined that instead of ABCs, it's now CAB. So when you look at that evidence-based process, they formed a hypothesis, they reviewed all the literature, and then they evaluated the evidence. After they did those 3 steps, they adopted the practice if the evidence supported it, which in this case it said, hey, it's time to make a change. Now it's going to be CAB. It's like that through all of EMS. It's just really easily explained through the American Heart Association way of how they do things. Now the EMS research, and this is, perhaps something EMS agencies are asked to take part in as far as gathering information, giving information, but this isn't something we'll ever do, on our own and say, hey, maybe we should try this and see what the outcome is. Your job is to work within your protocols, but understand that what you do changes periodically some things more frequent than others based on the EMS research. That research isn't all equal, but what we need to do is embrace the best practices. So what we're going to do is really what's been proven so far to be best for the patient. You're going to rely on those general observations. They'll turn those into the hypothesis, and then they'll start testing, kind of using predictive testing models to either prove or disprove their hypothesis. Once those other agencies do all of that, then all of a sudden you may have done something for the last 10 years in EMS a certain way, and now they're telling you need to do it a different way. And it's not that it's wrong, it's because they've gone through this entire research process to prove, hey, this is a better method of doing things. And with that, there's going to be a couple types of medical research. So there's peer-reviewed research, which you're going to find in true medical journals. It's research that's done, and then it's reviewed by different groups, different agencies, different people to help prove the theory. Now, if you just pick up your, standard GEMS magazine, you may read an article, but that may be an individual hypothesis on something that agency has done or that they're looking at moving forward with. It doesn't mean that it's actually been peer-reviewed, but it might be something that you can look at and see that, all right, in the future, this is probably the way things are going. All right, now through the course, we're going to talk about some of these special issues. So there'll be some local issues that we talk about, and then from an administrative standpoint, we've given you all the information regarding the course description, regarding the course layout, the meeting times, which we've discussed. This is going to be a hybrid model education. Again, kind of it's always been taught in the classroom, but does that mean it's necessarily the best way? In today's society, we're trying to put out a method of education that maybe fits the needs of more people, that we feel like we can give you a quality education and give you all the resources to be successful in the education and become a successful EMT. As we get further into the program, we'll talk a little bit more about the requirements for certification as an EMT. We've touched on it briefly with some of the NREMT and state licensures. But as we get through the program and understand where you're going to end up, then we can help you and guide you through what those requirements are going to be. Last thing to touch on here is the ADA, American with Disabilities Act. There's strict guidelines to help preserve the rights of Americans with disabilities. So as a student, you do fall into that category. If there's certain things that would help you fall into the ADA Act, you need to communicate with me separately outside of class, so that we can make sure that you have the best possible chance of making it through this program. We don't want to see somebody fail out of the program just because they didn't know or understand something. So if you fall into this category, talk to me separately. We'll see what we can do for you to kind of help things and help you progress through the class. And that does it for Chapter 1, everyone. So we are into the chapter review section. I'm not going to go through and read this to you. You're all adults, so you can all scroll through the last part of the review here. Understand that the quizzes and tests that we utilize are also from the same manufacturer as this book. So if they feel it's important enough to put it in the chapter review, they might feel it's important enough to put it in a quiz question or a test question. So take the few minutes, look through the next handful of slides here through the review component. If you have any questions specifically, let me know, and we'll try to get those answered for you. But this will kind of be the format for most of the lectures here, where we give you the tools, you do it on your own time. It gives you the ability to go back and say, hey, I didn't quite understand, the section on medical direction. Well, now you have the ability to go right back in the PowerPoint, read the PowerPoint, listen to what we have to say, line it up with what you read in the textbook. As long as you use all of the tools at your fingertips, I would hope that you will all be successful in this program. With that being said, if you have questions, don't hesitate to reach out. Our goal is to make sure that you are successful and that you become an EMT at the end of this program, and that's what we're here for. So with that being said, that's the end of Chapter 1, and then we'll move on to Chapter 2 next.